Hi, I'm Dr. Rolando Toyos. I'm here. My wife's also an ophthalmologist, Melissa Toyos. We have the Toyos Clinic, and I'm here presenting some research. So we're presenting research on cataract surgery, and we're also presenting research on dry eye. So I'm going to tell you a little bit about what we're talking about dry eye. I'm talking about new diagnostics in dry eye and new treatments. On the diagnostic part, the one thing that we're using now more than ever is the Oculus 5M to do meibography. So I think the best way to follow these dry eye patients is to do a pre-operative meibography, see how their dysfunction is, see if there's meibography showing atrophy of the glands, and then come back later after you've done your treatment and see if the meibomian glands on meibography are better. Now I'm talking about a couple of treatments. One treatment, as you know, the one I invented 17 years ago, which is intense pulse light for dry eye, that just recently received its CE here in Europe. So now they can advertise intense pulse light for dry eye with the luminous M22 Optima system. So with IPL, what you're doing is we're giving intense pulse light to the meibomian glands and stimulating them to work better. So that helps with dry eye and meibomian gland dysfunction. And the advantage that the M22 system has is that it has a chilling plate, so it's less aggressive on the patients. Patients feel less pain. I'm allowed to do more different types of Fitzpatrick types on skin types, so you can do brown skin, you can do lighter skin, so that's really improved things. One of the things I talked about in dry eye is that if you're going to be a cataract surgeon or a LASIK surgeon, you're going to have to improve the ocular surface. So one thing is we're using IPL to do that prior to surgery. The other thing we're using is Xiidra, which is a new drop from Shire, Lifidogras, which is an anti-inflammatory that works on decreasing the inflammation on the eye. The other thing that I'm presenting is a little home light treatment that I give to patients with meibomian gland dysfunction. It's an LED system that we call the Q. Patients can use it at home to improve their dry eye. The other thing that I'm presenting today, there's a lot of different things out there now for dry eye, is platelet-rich plasma for dry eye. So basically, we take the patient's blood, we spin it down to get platelet-rich plasma. That has 20 times the amount of nerve growth factor that you see in regular blood serum. They can use that PRP drop to help them regenerate their nerves and decrease pain. And finally, the last thing that I'm going to talk about today is a new drop called Oculosin, which is a preservative-free, all-natural drop that contains aloe vera, chamomile, and propolis. Those are three natural ingredients that are anti-inflammatory and may have some antibacterial components to it. Patients are using that as a dry eye drop in terms of a better artificial tear. They've been really happy with it. So there's a lot of things going on with the dry eye market, and we're presenting all of our research on all those things. So it's good to see you again, and tune in next time. I'm a consultant for Luminous, Zeiss, and Shire.